Okay. Welcome back. All right, so we'll take a quick look at the function of the X-ray equipment. So this is a GE Proteus. This is a very common system utilized at various clinical sites that we rotate through. So the first thing we'll do is we'll look at some of the motions that the table can do. So this is your general radiographic room. Other rooms are known as R and F, meaning that they have a fluoroscopic unit which is attached under the table, and it limits the ability of the table to raise and lower. So here we have quite a bit of range that helps us adapt to more difficult patients, taller, shorter, or whatever. So these pedals here, these indicate the motion you're dealing with. They could probably use a good, thorough, deep cleaning. But the motions are, you can float the tabletop, you can lower the table, raise it, or float it on either side. These pedals are also on the opposite side, so you can position from the other side. This little button here, this is how your classmates will punish you when you're trying to position and you're nervous. It locks the table, and they'll probably lock it on you while you're practicing. Just saying. So there's that. We don't use it a lot. It's not a manual lock. It's an electronic lock. It's kind of like a switch. So if that's on and a large weight is placed on the table still may shift. Some tables have like a rod and pin that will mechanically lock it. That will prevent that sliding a little bit better. This button, do not touch the red button. Okay, that's kind of a universal rule, right? That shuts the table off. All right, so if we take a look here, we'll start at the bottom. Typically your X-ray room, the beginning of the day or the beginning of the lab is going to start kind of in this position. You bring it up from the control panel, it powers on, but now we're going to use it, right? So these pedals work with double clicking. So I'll lay my patient down on the table if I'm going to use my table and I need to raise it up. Looks really easy. So that's up, it's down, so on and so forth. And there will be a competency over this process. So just get familiar with it. The table though, we float, okay? So this lock, as long as you hold it, it releases it to move in any direction as indicated by those arrows and that symbol there. So that's the basic function of the table. So if you come in a little closer, we're gonna talk about how the X-ray tube moves, okay? Again, if you remember the control panel video, here, here, and here indicate table bucky, tabletop, or wall bucky. There's also a tomographic motion that we will discuss in the future, but there's an option for that on this with IVPs and IVUs. Anyway, so we can adjust technical factors from here, KV and mass again, and then this just tells us a lot of information, okay? It's going to tell us our SID, which means how far we are away from our bucky, our film, wherever our film is at. But for the most part, what I want you to take away from this quick tutorial is how does this thing move? What are my options, right? And so they're pretty flexible. So angle, obviously, is going to let you angle the tube in directions that we consider caudal or cephalic, which you'll know soon enough. Vertical, up and down. Lateral is going to cross the table laterally. And then longitudinal will move back and forth, or head to foot, or if we were thinking from the perspective of the chest bucky, it's going to move closer, further away. All right, so those are the locks that are utilized. However, I use the all lock release, which is this one, because it gives me every direction. I'm a fan of that, or you just do it from the handle, which is really my favorite. Different tubes have different buttons and different symbols that represent the movement. However, the fundamental movement of an X-ray tube is the same across vendors, okay? So a Philips room, a GE room, a Siemens room, they're all gonna be very similar. The basic operation is the same, okay? So that's the motion. One of the most important things you're gonna deal with an X-ray or with X-ray equipment is the detent, okay? Essentially, that, depending on which method you're going to utilize, table bucky or wall bucky, you need to lock it in. So if I were on the table bucky here, I'm going to have to lock. If we look up, I'm going to have to lock in laterally, as indicated by my light, and vertically. Okay, you always have to detent two directions. Okay, 40 inches here, so lock there, and there we go. And the wall bucky's different. But just know for now that that's an incredibly important feature, okay? And the rest of this we will unpack in detail. But this is an intro again, so just take some time to get familiar with that. And a couple other things we are going to do. This is something you don't use often. I want you to be familiar with it here. So if you were to angle across, you can do that. It tells you how far you're angling, okay? So you kind of want to set that back at 0 so everything's right. And then I'm going to go this way. So if you come around me this way, and I'll show something here. This handle here. This is important when you're doing cross table work. So it allows you to completely move the entire housing to a lateral position and angle across the patient, okay? Or to add just some angle to anything that you might need to do. What you will find is, in x-ray, is there's about 1,000 ways to do everything, okay? So you'll get creative, and you need to master the utilization of this equipment so that you can obtain optimal images rather quickly, okay? So that's, there's a little intro to the use of some of the equipment. We'll go over the Bucky and a lot of the other specifics here in lab. So thank you. All right. A decent primer.